So let's talk about mental clarity. You've already mentioned brain fog several times. Sometimes I can't remember what I told my daughter 10 minutes ago. So explain how we can still stay sharp. Mental clarity. Help. I've said help 3 times now.
So I think, that's a generic, vague concept, right? But we hear brain fog. And I think there's a lot of potential reasons why people have brain fog. We were joking upstairs. We're constantly inundated, right? Our phones are giving us notifications. We don't sleep well. The news cycle, there's just a lot kind of going on in our brains all day long. And then as we age, definitely brain fog can go along with menopause and perimenopause, but even separate from that. And I get a lot of women well beyond menopause who are worried about cognition. It's a thing that we worry about, right? I can't remember where my keys were. I can't remember names. And there's some amount of that's normal, but then there's some amount that's not. And so being able to go to your doctor and really have that conversation, and there's so much fear, and there's so much fear really is, I think, a big reason why women don't bring up their questions. And so having a trusting relationship with your primary care doctor, with your OB, with your family to say, hey, are you noticing something? And I often will ask during an annual physical, how's your memory? How are things going there? Does anyone else worry about that? And so really being comfortable enough to bring it up is really the first step to make sure that there isn't something more serious going on.
What kind of evidence is there that mental clarity is connected to menopause? Dr. Vasavada?
Anecdotal right now. We don't have, so the studies are more based on dementia protection. We know that women who have brain fog are not at an increased risk of having dementia later. Despite having brain fog, cognitive function tests seem okay, even when you're having brain fog. And, I suspect a lot of it has to do is, I heard someplace that individuals, both men and women, have the most mental kind of flexibility in their 30s, 40s, and 50s. And so I do think part of what's happening with brain fog is occasionally your brain just trying to process all these inputs and make sense of it, and kind of sometimes just shutting down so that it can rest for a little bit.
Boy, that moth just loves us.
I'll say too, along the sort of cognitive brain wellness piece of it, and I'm sure you've all heard of Dr. Eisenberg and her incredible center. I love being able to send my patients to Dr. Eisenberg, who are concerned, right? And on some people with brain fog, cognitive concerns are going to have cognitive impairment and dementia. That's a reality. And then there are others who we say, what can we do to prevent that, right? And it's the same conversation we had about, heart health is brain health, right? Those same vessels, the same diet and nutrition elements, that same aerobic exercise are huge preventive, are important for preventing cognitive decline. The other things that we know, and I mentioned it earlier, is really good high quality sleep, right? How many of us are getting restorative sleep most nights? Women have sleep apnea, but often don't snore. And so they don't look like the sleep apnea guy, right? And so, but they may be the sleep apnea lady. And so being able to make sure we're screening for that. High quality sleep, I talked about. The other piece, and I love seeing you all here, social connections, staying connected with people, our children, our friends, our colleagues, reading, keeping your mind active. Those are all evidence-based things to keep our minds sharp throughout life.
And I'm going to add hot flashes. If you're having hot flashes and they're keeping you up at night, then get treatment.